Hey guys, today on Bulldog we're going to talk about anesthesia, surgery, bulldogs. Should I be nervous? I would say no. I think it's a case-by-case basis. Yes, do you have to take some precaution and definitely deal with somebody that's experienced with bulldogs? Yeah, but as long as you follow some of these simple steps we'll go over, you're going to avoid a lot of preventable issues when you go under anesthesia with a bulldog. So first thing we look at is, what's the surgery? What are we doing? Is this a routine neuter, or is this a complicated orthopedic or abdominal surgery that they're going to be under anesthesia for a long time? Prior to doing that procedure, there's a couple staging things we want to do. Pre-anesthetic blood work. I never use the term age as a precursor for surgery. Oh, my bulldog's just old, or my bulldog's too young. Typically, we want to look at, okay, what's their pre-anesthetic blood work look like? You can have a 12-year-old English bulldog that blood work looks great and their heart sounds great and they're probably an okay anesthetic candidate, versus a 2-year-old dog with abnormal liver values and kidney values that would be a little bit more high risk. So as long as blood work looks good, second thing we're going to do is place an IV catheter. This is an absolute must in a bulldog because that gives us guaranteed access to the vein for us to give our induction drugs, fluids, and if need be, any type of emergency injections during the procedure. Then we actually go under anesthesia. Typically what we do here is we pre-oxygenate bulldogs. Remember, it's a little bit more difficult for bulldogs to breathe, so we give them 100% oxygen before going under anesthesia. We want to minimize the risk of aspiration, so we'll always give these guys an antiemetic or an anti-vomit shot prior to doing all this, so they don't aspirate phlegm or any type of GI contents, because their probability for aspirating is a lot higher than other breeds. You want to take special precaution when we're intubating these guys. Bulldogs have what's called a hypoplastic trachea, which means their trachea is a lot more narrow and small, in which case we're not going to put a massive endotracheal tube in there and blow it up and potentially create issues related to that. Following the procedure, probably the most important part, and I think this is where most people make their mistakes. So this is where you can really separate people experienced with bulldogs and staff that's not. So when you're done with the procedure, hands down the most important thing is recovery. So with these guys, the general rule is we keep the endotracheal tube in until these guys are pretty much up and walking and looking at you. We call it the old cigar. They're looking at you with the tube hanging out. They're able to swallow. They're conscious. At that point, we'll extubate them. Why? Again, go back to anatomy and bulldogs. They have a lot more soft tissue back there. Their soft palate, their everted laryngeal saccules. Remember that small trachea. It's just a lot more tissue that kind of makes it harder for oxygen to get from point A to point B. So in the recovery process, definitely take precautions. So again, it's a case-by-case basis. Anytime you're going under anesthesia with a bulldog, you have to prioritize, why are we doing this? Is this an elective procedure, like we're taking the tail fold or anal glands or a palate, versus this is a procedure we absolutely have to, like an obstructive foreign body or mass or something like that? And then make sure you're dealing with somebody experienced, and then make sure you follow a little checklist of precautions. And when all said and done, like I said, this should be a fairly flawless process, but with any anesthetic thing, we never use the term routine. You always want to be proactive rather than reactive when it comes to anesthesia, and hopefully everything goes perfectly fine. But hopefully that helps. But like I said, take precaution, make sure you're dealing with somebody experienced under anesthesia and in surgery, and you should be fine. All right, guys, take care.